Welcome to Black Health Matters. I'm Daryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callender.
We'll go through some things. This is an article that, and sometimes it's lost on people because of COVID-19, that other diseases are still killing us. And it's very important to not ignore illness just because of COVID and to think that everything's about COVID. Hypertension and GI problems are still with us. And so we have to take care of ourselves, love ourselves, take care of ourselves, COVID notwithstanding. And so when things like diarrhea occur, which also can be associated with COVID, we have to become aware that as you can see there, GI can be a manifestation of many things, including COVID. And then, of course, if you see blood in the stool, whether it's black or maroon or bright red, it's something that means that you need to be studied to make sure that it's not colon cancer. And as you know, there are other causes, but the one that can be treated and prevented is colon cancer. If it's a polyp, it can be removed, and polyps develop into cancer. And of course, colitis and diverticulosis are problems as well. Difficulty swallowing, of course, is another problem, and esophageal cancer is something to worry about, as well as other. The esophagus is the tube that conveys the food from your mouth to your stomach. And so when you have difficulty swallowing, that's what it points to. And the identification of what the problem is can be done by having an x-ray or having somebody look down your throat to find out why you're having difficulty with swallowing, which is often related to the esophagus.
I have an endoscopy scheduled in three weeks.
Oh, okay.
That I put off for 5 years.
Oh, really? It's because of your GERDs, is that why?
Yes.
Dr. Callender, my dad is having trouble swallowing, but they told him that the muscles in his throat have, atrophy or whatever. They're just weak.
Yeah, it's very common in older people. A number of centenarians have had difficulty with swallowing for that very reason. Yeah. Is he doing any better?
No, they've got to crush up his medicine. They have to crush up his food. He can eat applesauce,
How's his weight coming?
His weight, everything else is fine. Everything else is fine. Just swallowing is just a problem. Can't swallow anything.
Yeah. Unexplained weight loss, especially if accompanied by abdominal pain, but makes you wonder about cancer, of course. So you have to have studies to eliminate that as a problem. Then, of course, prolonged constipation, I think Daryl has talked about how the diet can contribute to that. But if you don't have at least 1 or 2 bowel movements a day, that's does not, is 1 or 2 bowel movements a day is associated with good health. If you don't have a bowel movement a day, then that requires an investigation. And any sharp pain in your abdominal cavity is a reason to go see the doctor. I had somebody say, which I thought was preposterous, that it was too much pain to go to the hospital. That's why you have hospitals.
Mhm.
and so that to relieve pain. But anyway, sharp pains like that, if you ignore it, it causes things to get worse and can lead to an unnecessary death. So an ounce of prevention is worth a pound of cure, and the early diagnosis can keep you from having a preventable death. So regardless of whether there's COVID or not, you have to take care of yourself. Now, tinnitus is something that Janice knows about because Chris had this with his Meniere's syndrome. And ringing of the ears is something, if you've never had it, you can't quite understand what it means. And hearing loss that goes along with it is not pleasant. And unless you've had it, you don't really understand it. Then the vertigo that goes along with it, because you lose balance, becomes something that is not fun, to say the least.
Doc,
Any-
you know about Beethoven? Beethoven, when he wrote his Ninth Symphony, was practically deaf. He had tinnitus, and he heard an A. He heard the pitch A constantly pounding in his ears. And if you listen to the beginning of the Ninth Symphony, it's indicative of that drone that he heard. Ringing.
Amazing, yeah.
And that's Chris's problem now. Usually with the loss of hearing, you have tinnitus, and he has constant ringing. And they want to do surgery, put in the cochlear earpiece, the cochlear implant.
Right.
Mhm.
He's decided against it, I guess.
He's working towards it. Next visit, he might have a date. And you know, this has been going on for a while.
Right.
And you know, he's progressed. I mean, he woke up, lost his hearing, couldn't walk, but the tinnitus is constant. So he's doing it for the tinnitus more so than the hearing loss. Hearing loss, he says he can, do the hearing aid and work with that. He can read lips. It's the tinnitus, morning, noon, and night, 24/7.
Yeah, I had it for a brief period, so it's bothersome. Like, it's inconceivable 24/7 to have tonight.
Yeah.
It's just
Yeah.
Amazing. It's interesting that have any of you had tinnitus?
Yes.
Yeah, I have it now.
Mhm.
I've had it.
It's not fun, is it? No.
No. And I've also had this popping in my ear that prevented me from hearing. And it was after I had come home from vacation. I was riding home on a train and I couldn't hear in that one ear. And then all of a sudden it went away.
I have that now. I'm going to the doctor this coming week, next week, about that. It pops.
Dr. Callender, this article here related to COVID-19, it said may affect your hearing, may affect this, etc. My question is, are they talking about pre-COVID-19 or during the time you have it, or
during the time you have it?
Okay.
Yeah. Mm-hmm.
Yeah, I've had serious ear issues. I had an inner ear infection when I was a kid, and as a scuba diver, I have to take extra super care of my ears because you have to equalize. You know, when you go up in the plane and your ears pop when you get up and come down.
Yeah.
You know, if if your station tube is blocked, some kind of any kind of way. Can cause severe pain, and actually, if you dive without equalizing, you can rupture your eardrum, and that can end up in permanent hearing loss, permanent deafness.
The Eustachian tube is what? That's the tube that takes the sound from the outside to the inside. And so it's just like the esophagus is a tube that conveys food from the mouth to the stomach. The eustachian tube is the sound waves from outside to inside. Yeah. In case some of you didn't know it, when he mentioned the eustachian tube. Okay. It's interesting that the link between depression and anxiety, of course, it talks about the ways of dealing with anxiety. And of course, with us being homebound, depression is doubled and tripled. So that becomes something we have to deal with more than ever before.
And Doc, I have an excellent yoga instructor. If anybody's interested, I can give you her name. She her lessons are on YouTube. You can do them at home.
Okay.
All right. Let's see.
They mentioned what Janice had mentioned about Chris. This is an article about what we watch to track the pandemic and decide as to when the restaurants can open, the movies can open, and things like that, and when we can stop being required to stay at home. And the number of new daily cases and the number of deaths are two things that they look at, as well as the number of COVID-related hospitalizations. And both of those have gone down recently since the vaccine. Nowadays, no matter what you go to the hospital for, you get COVID testing. I mean, as a patient, whenever you go, every operation requires a negative COVID test. It's interesting that one of the articles you read shows that 100 million shots have already been given nationwide, which is great. Of course, we have to get up to about 250 to 300 before we talk about the herd immunity. And one of the figures, some say the lowest is around 70%, but I think we'd like to get up to 80%. But what is interesting is that in the hospitals, for example, at Howard University Hospital, only 70% of the healthcare workers were vaccinated.
Oh.
Which if you think is low, which I think is low.
Yes.
At another hospital, University Hospital, 55%, only 55% of healthcare. So it's interesting, is an incredibly low figure for hospital staff. And I think by the end of the year, it's going to be required for hospital staff, just like the flu vaccine is required for hospital staff.
Well, Dr. Callender, when you say hospital staff, that includes doctors, nurses, orderlies, just anybody working in the hospital, right?
Yes.
Okay. Do you think that the rate would be higher for doctors and lower for other staff?
I don't know, because they test everybody together. I would hope that it'd be higher for doctors, but I don't know the facts. And when they talk about hospital staff, they talk about all of them together. And I haven't seen that figure for doctors. That'll be interesting to get. I haven't seen that yet in terms of what percentages the doctors versus the rest of the staff. This article talks about the myths. If you've had COVID already, you don't need to get vaccinated. It's also interesting that there's a lot of studies suggesting that if you have a severe reaction to the first dose, it may suggest that you already had the virus but didn't know it. Once you receive the coronavirus, you're immune for life. Nobody knows the answer to that question, so that obviously is a myth. Because the only way you know that is get the vaccine and have antibody tests for the rest of your life, and that has not been done because the virus is only been given about a year ago, not even a year ago. So,
Dr. Callender, I got a question. Could you scroll back down? They said once every 3 years for like the flu. I thought you get the flu shot every year.
you get it every year.
So what does it mean? Perhaps once every 3 years?
I don't know, that's wrong, okay?
Okay.
That's just wrong, period.
Mm.
You need the flu vaccine every year.
So
Because
this vaccine, they're saying the COVID vaccine once every 3 years instead of every year.
No, we don't know. That's what I just finished saying. We don't know. He said perhaps. We don't know. It may be, the only way we'll know is we'll get antibody tests on everybody that had the vaccine and see if the antibody tests are high or low. If they're high, then that may mean you only need it every 2 or 3 years. If they're low, then that will mean need it every year, but we don't really know the answer yet. We'll know with time, but we aren't close now because the first vaccines were given in September. So we're not even a year yet. So we can't possibly answer that question. Third myth, you can ditch your mask after you get vaccinated. We know better. But people are testing it though. People are testing it. People down in Miami are testing it. So when 70 to 85% of Americans are vaccinated, that's what will be the time when we will have herd immunity. But even then, that's when we can go back to the so-called normal. So when we get up to around 250 million people vaccinated, then we're approximating the herd immunity that they're talking about. Some people still believe that they use live version of the virus, which they don't. So that's a myth that needs to be done away with.
Dr. Callender, I thought this was interesting that the Johnson & Johnson uses a different technique that the other ones do.
That's correct.
As far as getting the vaccine into your body, into your cells.
That's right. Mm-hmm.
It actually uses an adenovirus.
Right. Although it's not the coronavirus.
Right.
This is a common myth. It can alter your DNA. Yeah.
Well, I hate to sidetrack, but let's see, when they do bone marrow transplants, there's been reported cases where that did alter the DNA.
But a bone marrow transplant
Yes.
is completely different.
Mhm.
Right.
Right. Well, my
Yeah.
question was, okay, like organ transplants, they're different than bone marrow. Is there any possibility of altering DNA with an organ transplant, like a kidney or liver?
Extremely unlikely because they don't really alter the DNA. I know of no report that really has actually tested specifically this question in terms of organ transplant. Bone marrow transplants, your entire cell line is affected by a bone marrow transplant, whereas the organ transplant is just a specific organ. So in many ways, the good book says, talks about the belly button and your bone marrow, because the bone marrow is the source of just about everything. And so bone marrow transplant could affect the DNA and RNA, but not the organ transplant as far as we know. We know because it's a separate organ system that only involves replacing the organ, whereas the bone marrow is the essence of you, is your bone marrow. Everything about you actually kind of comes from the bone marrow. So that's not a sign. That's right on target. You don't need both doses. There's a lot of talk about that, and the question is, that's a matter of opinion. I think the maximum effect is clearly 2 doses. But when you think about what happens with the flu virus, as Darryl has mentioned, as others have mentioned, the flu vaccine rather, is associated with about a 55 to 60% effectiveness. So in many ways, 1 dose is about as effective as a flu vaccine. So so it's not 95%, but it's okay. So, but I think if you had a choice of 95 and 52, I think you'd prefer the 95, which is why the second dose is mandatory. This is a question that came up many times about and people who have allergies do get the vaccine. It's just that they're more likely to be among the group that have anaphylaxis. And that's why you have to wait 15 minutes after you've had the vaccine. But in spite of allergies, you still can get the vaccine. I like the point that he says, those with a history of anaphylaxis should stay inside for 30 minutes, whereas those with no history can leave after 15 minutes. Anybody know if there have been any deaths associated with the vaccine?
I'm sorry, what is that?
Do any of you recall whether there have been any deaths associated with taking the vaccine?
I have heard, I don't know how true, but a neighbor of mine's mother was 74, and she had the vaccine, and 4 days afterwards she passed away. However, she did have underlying health issues such as heart problems and so forth. So again, Dr. Callender, I think it remains one size doesn't fit all. And when we hear these deaths, we do need to know really what maybe have been going on and with the, with the person.
Yeah, I think, yeah, go ahead. Go ahead, Darryl.
I did a search on that last week, and it says no reported deaths directly related to the vaccine. But there's a lot of people that were gonna die anyway, but they got the vaccine. And I think Marvin Hagler was an example of that. His wife said that he died of other causes. It wasn't the vaccine, although he died like a week after getting his second shot, but it wasn't directly related to the vaccine.
Yeah, that's I think your point is well taken, and both of you have said it well, that there have been deaths, and most of them have been associated with other illnesses. But it's kind of the question is, if you have 10 deaths in 100 million cases, is that enough for you to not take the vaccine? And I guess that's an individual decision.
Dr. Callender, I'm trying to get a battery for my car key. And I was in the jewelers, and it was a Hispanic man that came in, and they were talking to, it was just 3 people in the store, and they were talking about who has gotten their vaccination. Oh, there were 4 of us. The Hispanic man vehemently just got outraged, and he said he'd rather not take it because too many people have died because of it.
What?
And we questioned, he said because he has diabetes and he doesn't want to die. And they were trying to persuade him that nobody has, but he was just so perturbed that if he got it and he had diabetes, he would ultimately die from it. And they said, well, you either die from the COVID or not getting the shot. And so I was just wondering, where did he get all of his facts from? And it's really fear. He was
Yes,
fearful.
fear. Yeah.
Social
Yeah,
media.
I think,
Yes, social media, you got it from Trump.
yeah, well,
Mhm.
and people like that, you can only tell them the facts and then hope that they will accept it, because there's nothing else you can do.
You know, Dr. Callender, another question comes up in my mind, and that is, if you have pre-existing problems, shouldn't you get those problems straightened out before you take the vaccine?
Well, you can't eliminate diabetes if you have it. You can't eliminate hypertension if you have it. You can't eliminate the chronic illnesses that are with you. So you can't, these are people who have chronic diseases that cannot be eliminated. So that's the answer to that question. The diabetics are controlled as well as they can be, but they still have diabetes. The obese patients are obese. And if you get COVID and you're obese, it's too late. So many of the chronic conditions, they're talking about chronic conditions. Acute conditions are different.
Right.
But chronic conditions cannot be alleviated. If you have an acute condition, that's different.
Dr. Callender, the same thing comes up for organ transplants. Sometimes you don't qualify for an organ transplant because of some condition that you might have.
Yeah, and the condition that you might have are cancer and severe heart disease that would make you die within a year from the operation. So yeah, but acute conditions would need to be corrected before you before you have anything. If it's an acute condition, acute infection or something like that.
Okay, well, let's
But
take
chronic illnesses, there's not much you can do about.
let's take those two conditions and relate them to the vaccination, cancer and heart disease. So if you have either one of those, should you take the vaccination?
Yes, yes, because it depends. Now, again, if you have terminal cancer, then I don't know anybody would advise you one way or the other. But if it's not terminal, then yeah, you should take it, because the question is, what's going to kill you first, the COVID or whatever chronic condition you have. And if the chronic condition is something that's going to take 10 years to kill you, then now, for example, if you have heart disease and your ejection fraction, which is the way you measure heart disease, is less than 20%, then the question is, which is more likely to kill you, the heart disease or the COVID? And I think your doctor would have to make a decision about that to help you with that decision in terms of the heart disease and the cancer. So that cancer survivors, of course, would take the vaccine. And the people who've had a heart disease that's treated by a transplant or some other mechanism, or has had a heart surgery that has corrected the problem, then they are good candidates. And just as they would be if the condition was corrected before a transplant.
Thank you.
It's interesting. Been a lot of controversy about AstraZeneca. And while there's a lot of talk about it, it seems that it's effective for all ages. Although there have been some locations because of blood clots that cause people to lose trust in this drug. But most of the data suggests that given the drug vaccine 4 weeks apart, is a way of stopping severe disease and hospitalization.
Dr. Callender, the AstraZeneca people are fighting in court right now because they were fighting because back in January, they said that AstraZeneca found out that they did not complete their testing, and they started giving out the vaccine anyway.
That's correct. And Fauci made a comment about that, that they were, it borders on dishonesty.
Yeah.
Right. Yeah. And so you're right. That's being discussed right now to find out whether the data they gave was accurate. It's tragic because it's most of the results suggested it was a good drug, but time will tell what really is the truth on this.
Yeah, but guess what? If they lose the court battle, that's going to have an impact on a lot of things. If they,
As far as AstraZeneca's vaccine is concerned.
yes. Mm-hmm.
Yeah, but we've got Moderna and Pfizer, so. Yeah, but you could see that the reason that they suspended the use had nothing to do with that, though. It had to do with the blood clots. And but that's how things happen in life, you know. You never know what's going to stop you. So it's going to time will tell about it, though. But I was surprised at Fauci's comments.
So, Doc, you have a measure of the percentage of blood clots that were associated with the AstraZeneca?
It was very rare. I don't know. They said, as they say here, that was very rare, but I don't know what they meant by rare. You know, rare means something. One in 1,000 is rare. 1 in 1,000,000 is even rarer. But I don't know what percentage they were talking about when they said rare blood clots.
Mm-hmm. That's not
a drug that has been approved. Johnson & Johnson has been approved, but I don't think AstraZeneca has been approved here yet. So when it comes to the FDA, it'll be interesting to see.
Okay.
Dr. Callender, are all countries paying for the vaccine
Yes.
over the world? So that means that nobody in any country has to pay for this.
No, I said yes. They are paying for it. The country's paying for it.
The countries are paying for it, right?
Yes, yeah. And how they decide to mete it out to the rest of their countrymen is up to them. Of course, here in the United States, it's been free to everybody. And that's the way it was from the beginning. I think, what did they say now is 111 million that received injections, and the goal is to have everybody vaccinated by May. Is that correct?
Yes.
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 Yeah. And then that will force us to think about what's happening across the world, where poor countries do not have access to the vaccine at all.
Mm-hmm.
Which is a concern. Of course, we had our own issues with administration. We still have issues with administration because people still haven't received the vaccine. So we'll see what happens that if by May everybody actually has been vaccinated. That's an interesting question here. Is flying safe now? And this article addresses that and answers many of the questions. Now, I can tell you, if you're thinking about flying, they are booking every seat they can. And middle seats are being used. So don't think for a moment that you're going to find empty seats.
Is it cheaper now?
I don't know about price. I don't know about price.
Because I heard someone saying that you could go to Hawaii for $300.
Yeah, my daughter just came back from Florida and her round trip, I think, was $29, something like that.
Oh, my goodness.
Yeah.
Them
It's cheaper.
them young'uns, huh?
That's all supply and demand. Once travel picks up again, the prices are going to jump.
All right. Enjoy it now, right?
Hmm.
So Fauci is still recommending that people don't fly.
Yeah, but well, this article talks about that because the danger is not so much in the flying as it is in before you get to the plane and after you get off the plane. Because that's where the biggest danger is, because you encounter all those people on the lines. And social distancing is not what you'd want it to be.
Yeah. Well, now another couple things. Even when you've had a couple of shots and you've had your 2 weeks, and so you've got, so-called full immunity, but none of these vaccines are 100% effective, and that 5% means that some people are still getting infected with COVID after they've had their so-called post-immunity period. And when you're infected, you can be a symptomatic or asymptomatic carrier. And so, it's possible to spread the virus, which means that the longer it gets spread, the more variants are created that are more resistant. So it's, that's probably some of the other reasons why Fauci is saying just don't jump in to resume your normal traveling, or, you got to start traveling a lot because you've been cooped up so long.
I don't know.
Doc, I'm sorry.
Go ahead.
With scuba diving, now the dive industry has really taken a big hit from COVID, and a lot of when you travel, you have to stay in a hotel. A lot of the hotels are closed because of COVID. The staff, might get an infection or whatever, but so now in order to go to these countries, you have to be, I think we mentioned it, you have to be tested within 3 days of travel. You have to be negative. Even if you have the shots, you still have to be COVID tested. And in order to come back from these countries, the United States demands the same thing. You have to be negative within 2 or 3 days before you can return. So it's very tricky. You don't know who you might run into in Costa Rica or whatever, and then suppose if you come up positive, you're stuck there for another 14 days before you can even get back on the plane. So it's very tricky. It's scary to a lot of people, and it's dangerous too.
Yeah, that's why Fauci recommended not doing it, especially international travel.
Yeah.
I think that this puts things in the proper perspective. The way they've addressed the ventilation has been very positive in terms of on the airline. So it's not like it used to be, where there was lousy ventilation already, but that has been improved dramatically.
Stop now.
Hey, good morning.
Hey, Chris.
Hey,
All right,
Chris,
how
how
y'all
are you?
Good. Mom was just explaining to me about what you all talked about at the beginning of the session about hearing loss. If I can, I would like to speak on my experience with it. If you guys have like a minute or two.
Go ahead.
Okay, cool. All right. Back in 2018, April of 2018, it was a sudden hearing loss. What happened was I started getting this tingling sensation on the right side of my head after I finished taking a physical fitness test. And about several hours later, the tingling sensation started to get worse. I laid down, woke up the next morning, and boom, I couldn't hear anything. So we tried putting a peroxide in the ear and putting cotton balls in the ear and all that good stuff, thinking that that will help. But then that went on throughout the day. This was on a Sunday morning. By Sunday afternoon, I couldn't walk. Vertigo set in, and walking was extremely difficult. Took me to the hospital, and I stayed in the hospital for about a week, trying to gain, I guess, some stability with walking, but that didn't come. But then I had several hearing tests, MRIs, and X-rays, and all kinds of stuff, CAT scans, so they could try to figure out exactly what's wrong with me. And it all stemmed, well, it came down to it being stress related. Since then, I've been having all sorts of hearing tests, and it's getting worse. Currently, I'm still around that 98% hearing loss in my right ear. There's two surgery options at this point if I want to go through them. The two surgery options are stapedectomy. The stapedectomy is it's a bone in your body called the stapes bone, which is the smallest bone in your body in your ear area. And they want to put an implant in place of that bone, which will possibly give me some hearing back. The other option would be the cochlear implant. The cochlear implant is that device that you may see people wear on the back corner side of their heads. That device will give me a better gain in hearing versus the stapedectomy, and then also a good possibility to get rid of the tinnitus. The tinnitus is the ringing that you have in your head that prevents you from getting some good sleep. Sleeping for me is extremely, extremely difficult, to the point where sometimes I do take Tylenol PMs and things of that nature, so I can try to at least get 4 to 6 hours of sleep. My average, even though I may be laying down, my average sleep is anywhere between 3 to 4 hours a night. That tinnitus for me is the worst part of this whole hearing loss. I honestly, I can't, I'm dealing with it, and I say I can't deal with it, but it's just extremely difficult to deal with, extremely. Even now, as I'm sitting here talking to you all, I have that constant loud ring in my head. And at night, when it's extremely quiet and dark, that's when it's difficult. It is extremely, extremely difficult. You have, I've read some stories where you have some people, they just can't take it to the point where they commit suicide. I'm not there. I'm not there. But do I think about taking 2, 3, 4 pills so I could get some extra sleep? Yes, I do. I think about that, but it's hard to deal with. And I just went to the doctor last Friday to have what they call a cochlear implant evaluation. And it's like a 2 to 2.5 hour process of testing that they do. They came up with auditory neuropathy doing that testing, and they were saying something about the eardrum, or the ear canal or the eardrum area was working, but it wasn't sending a message to the nerve. But then they ruled that out. There was more testing that they had to do. They ruled that portion out, but they still are trying to figure out why isn't the sound being sent to the nerve. So I'm waiting on the ENT doctor. His name is Dr. Ho. who is a very popular doctor. He also works at NIH as well. And I'm waiting for him to get back to me to let me know what my best options are as far as the stapedectomy and the cochlear implant. We've already had conversations about it, and we both said the cochlear implant would be the best option, but it's still, even though it's ultimately my decision, it's still his decision as well. And I just want to go with the best option of what he may recommend at this point. And I go back to him on April the 16th. And that's when we will say which surgery we're going to go with. But I'm hoping for the cochlear implant because that is the surgery that will possibly take away the tinnitus. It's a greater percentage with the cochlear implant to take away the tinnitus versus that stapedectomy surgery. The stapedectomy surgery won't help me out with the tinnitus.
If you go down on this article, that's what they conclude. If you could keep going down, John.
Okay.
If you keep going down, that's yeah, right there.
But if the hearing loss doesn't respond to medical treatment, Gonzalez says we often recommend to use the use of hearing aids, bone anchored implants or cochlear implants. Yeah.
Well, thank you for that, helping us understand. Those of us who've had tinnitus for maybe an hour have an inkling of what you've been going through for 24 hours a day, 7 days a week.
Yeah, it's difficult. It's definitely difficult. Coming up on 3 years this April. But I don't have my hearing aid in now. Sometimes it can, it's just an added device that you have sitting in your ear all the time. It's like somebody that wears glasses. They may not wear their glasses all the time. But can I hear? Yes, I can hear out of my left ear, but out of my right ear, you can cancel that. You can cancel that. But yeah, I'm looking forward to getting the surgery so I can possibly get rid of this tonight. It's unbearable sometimes.
Well, thank you very much. Wow.
You're welcome.
Any other? Yeah. Okay.
Do you guys have any questions?
I don't know any question we can have. You answered all the questions.
Dr. Chris.
You made it clear. You made it perfectly clear. Wow.
I have a question. So is the vertigo related to the tinnitus?
You know what? We haven't really concluded that, but
You can walk.
can I walk? Yes. Can I run? Yes. Can I ride my bike? Yes.
When it happens.
Can I drive? Yes. At one point, they did take away what they said. I wasn't supposed to drive and all this other good stuff. And when it first happened, I still try to get out there and ride my bike. I've fallen off my bike twice. One time I dislocated my pinky. My pinky was sitting in the opposite direction. So I had to pop it back in, get back on my bike and ride back home. Do I still have the vertigo issues now today? I had an issue. This was recently within the past couple of days. I want to say it was Sunday. Sunday, I had an issue after we finished riding. I rode 27 miles on my bike on Sunday.
Wow.
As soon as I finished, got back to the car, I had to sit there for a little while because it wasn't like it was spinning, but I wasn't stable. So before I put my car in drive and take off, I just sat there for a while. But that it does happen, I'm gonna say 2 to 3 times a month. I am supposed to be taking medication and stuff, daily medication for that, but I'm on blood pressure pills, and that's the only pill that I take. And my migraines, I have issues with. I take medication for that every so often. I'm tired of taking medication daily. You know, I just take the blood pressure medication and that's it. I'm not taking vertigo medication daily as well. I'm not doing that. I don't call me hard-headed.
Any other questions for Chris? Well, you heard it from the source. Good to see you, Chris.
Yes, sir.
Yeah.
Earlene, did you ever have to take vertigo medicine?
Yeah, I had to take it. I'm still taking it because some days I can barely walk.
Do you find that it helps you out,
Falling.
any?
Huh?
Do you find that it helps you out, any?
No, it doesn't help me at all. And a matter of fact, my pharmacy won't give it to me now. They only gave it to me in January and said I can't get it anymore this year. Wasn't helping anyway, so.
I agree.
Mhm. I really don't know what caused my vertigo, though. I really don't. But I've been like this since I was transplanted.
Well, they don't know what causes vertigo either.
Mm. Would a loss of blood cause it?
No. We don't know what caused it. We don't know what caused his vertigo either.
Mm.
Well, I did hear Chris talk a little bit about stress. And maybe one of these sessions, we need to really talk about this stress.
Actually, we have many times, but this, you can't talk too much about it.
Yeah,
Stress
because
reduction.
might get stressed out.
Well, I wasn't stressed, so I don't know what caused my vertigo.
We
I
have
was happy.
unknowingly stressed too. Sometimes we're stressed and we don't know we're stressed.
That's true too.
Okay. This is an interesting article that talks about a strong reaction to the first COVID-19 vaccine may signal previous infection. That's pretty much a guess. We don't know that, but this is one study that in Israel. And as you say, it opened a debate. And there was a marked increase in antibodies among those who previously had an infection versus those who hadn't. So that's why they concluded that that may be why you have such a strong response to the first dose. Although, have any of you had a strong response to the first dose?
I
I don't
ate
know.
for like 3
I
days.
did. I'm actually still recovering. I got my first dose on Saturday.
What symptoms did you have?
Extremely tired. I'm a breast cancer survivor and I have one breast. The side that I received the shot in, that breast has been aching ever since then. I have no appetite. Today is probably my best day. So it's Saturday and today is Thursday. So yeah, it's been kind of a roller coaster. No headaches or anything like that, but extremely tired. Say like put the dishes in the dishwasher. That was a chore.
Yeah, fatigue is one of the commonest common side effects as well.
Yeah.
Yeah. But then how long is it? You had the last shot when?
Saturday.
Oh, okay. Yeah, because they say the side effects may last up to 8 days after the injection. For some. For some. For some, it's for most of us, it's the first 24 hours, but for some, it can be as long as 8 days. The fatigue is the one that lasts the longest, I think.
I had a headache
Yeah.
and I was nauseated for like 3 days.
Dr. Callender, sometimes I'm asking a question actually, but sometimes after you have the first dose or the second dose, you can find out that you had some underlying problems that you didn't know you had. Is that true?
Well, I don't, that's a kind of strange question. I mean, it can always, that can always be the case, but I don't know. I don't know how to answer that question because it's a kind of strange question. Could you rephrase it so I can really answer it?
Yeah, when you take the shot, you can find out that you had some kind of a medical problem that you did not know you had before the shot.
Yeah, well, okay. What you're saying is it pre-existed everything, but after you got the shot, it got worse. Is that what happened?
It got revealed.
Oh, got revealed. Yeah. Well, I don't know that there's much data on that. I think your personal experience may be something that answers that question. I don't know. I personally don't know the answer to that question. And I think that remains to be seen. But it makes sense that if you have underlying problems that are already there, they could be intensified by the vaccine. But I don't know that there's any data on it, right?
Right. The reason why I asked that question is because I don't know how long I've had diabetes, but it was revealed, later after the second shot, it was revealed. I mean, after I got out of Georgetown University Hospital the second time, they discovered that I had it, and I have no idea how long I had been dealing with it. I don't know. You've been doing my blood since January, and do they test for your glucose level?
Well, your blood sugars have, I mean, that's personal, but yeah, your blood sugars have been on the high range.
Okay.
Yeah. And the range that would make you think of you being pre-diabetic. So so it's not that it would cause diabetes, but what you're saying is, would it unmask something that's already there?
Yes.
And that's a good question to which I don't know the answer. So I don't know. I don't know. This is interesting because the lady who co-founded the vaccine maker talked about harnessing the system to tackle tumors. And as you know, the Nobel Prize was given in 2018 because they found a way to use the immune system to eliminate cancers, especially some breast cancers. I'm sorry, especially some melanomas and other cancers, including breast cancer. And so they're talking about using this technique to tackle tumors as well. And since cancer is one of the leading causes of death, this certainly is a welcome effort. Anything we can do to eliminate deaths from cancer is desirable.
Dr. Callender, I found that Howard Hughes had a shoot. I'm having an echo. Anybody else hearing my echo?
Yeah, I hear.
Yeah, but go ahead. We can hear you though.
We all here.
Okay. Okay, now it's better?
Yes.
Okay.
Yeah.
All right. So 10 years ago, Howard Hughes Medical Institute had I think I mentioned this before, had a holiday series, lecture series, where they talked about the computer technologies that they were using to sequence the dengue virus. And it's ironic that the exact same scientists that helped to get the vaccine for the dengue are also using that same technique 10 years later to sequence the the RNA of the COVID SARS-2 virus. And this technology has been around since I think the past 20 years, because that's how they did the human genome, which figures out the entire code for humans. And they had already done a bunch of animals and plants before that, but the human genome, I think that was, do you remember when that was, Doc? I think it was
2003. Completed in
2003.
2003.
Okay, so that same type of technology has been developed and continues to develop. So it's extremely sensitive now, and they're using that same technology. They're going to apply it to cancers, and it's pretty exciting to me, being a biology major in college, to think about how they've developed these techniques to find RNA and track it, and being able to apply to save lives. It's really amazing.
Yeah, and I think that the RNA technology that developed this vaccine is a good example of that. Everyone vaccine eligible by May the 1st. Well, it's a great goal. 530,000 Americans already, and remember the 1918 virus killed only 600, well, it killed 650,000 Americans. So we're approaching that. And it's interesting how we talk about America and how this has weakened Americans' impact across the world. And people are calling America has been major power because of its inability to deal with this virus. Because when you look at the numbers, we are 2 to 3 times the mortality rate of any other country in the world. And so it suggests that our healthcare system is inadequate.
Thank you, Trump.
Wouldn't it also suggest that we're 2 to 3 times fatter than any other group in the world?
Well, we know that anyway, yeah. We're that too.
Agree.
We're that too, right. Mm-hmm. And we spend more money on health than any other country in the world.
We also
It's-
have a worse diet than anybody.
Yes.
Well, it's all the same thing. It may all be related.
I'll drink to that.
Yeah.
I'll eat to that.
Yeah. Well, the question is, what will happen will the vaccine prevent the 4th wave? And time will tell.
There's still a lot of bad negative social media about the vaccine, believe it or not. And a lot of people that wear red hats are still saying, no mask. They're burning the mask. They're saying, you can't make me wear a mask. You can't make me, it's like, you can't tell me what to do. If I decide I'm going to do it, it's okay. But you can't mandate me to get a vaccine. And just that attitude, even in spite of saving your life, is causing people to die as a result. It's so strange to me.
Yeah, it is. It's tragic. It's tragic, but it's evident that it's right there. Why you have some people who are anxious and trying so hard to get the vaccine. Yet you have people like you talked about that just the opposite. Well, the more you read about it, the more you realize how vital it is to be vaccinated. And it makes you kind of sad in a way, because you realize there's so many other countries who can't afford the vaccine at all.
Right.
And the poorer countries, some places in the continent of Africa and other places, may not be able to get the vaccine until 2022, which means there are a lot of people who will die before then. So while we're blessed in being in America there, we have to understand that there are other countries that don't have the ability to pay for the vaccine. And how do we try to get equity across the world? Of course, the first thing is to get as many people vaccinated here in the United States first. But we still have to be concerned about the rest of the world. And it's interesting that 1/3 of Americans are still hesitant after all is said and done.
More Republicans, so.
You think that many of the people who are not vaccinated are Republicans?
Yes, it's documented that
So it's the Trump effect, huh?
it's the Trump effect. Yes, even though he did come out and say, "All right, you guys should get vaccinated." I think last week he said that it's too late. The damage has already been done.
Yeah. Yeah. See, where that fatigue you talked about was number 2, huh? It's a headache.
Mm-hmm.
$4.5 per million, huh? Wow. That's rare. This answers the question that you had about deaths. Well,
That's
when you
interesting.
talk about 200 out of the thousands and millions of people who are getting pregnant, getting vaccinated, that's a small number.
Mhm.
Well, that clearly suggests that sperm is being included in the vaccine.
Thanks, Darryl.
You're welcome.
That proves that the vaccine increases the ovulation period.
Okay. We're not in the end zone yet. Yeah, he's right. We're getting close, though. We're on the 10-yard line, maybe. What do you think about these places that are rolling back the mask mandate?
I think it's stupid.
Stupid.
Yeah, I do too. I don't understand these governors that do things like
Well, I understand them. That's that individual rights thing. You can't tell me what to do.
that.
The government cannot mandate me to do anything that I don't want to do.
Actually, that's not true. Because if you do something that hurts everybody else, then you can't mandate. And the reluctance to do that is dangerous.
Somebody's making a lot of noise.
Yeah.
You need to mute.
No, it's outside my window.
Oh.
They're power cleaning the windows.
Oh, okay, cool. All right.
It just means these governors are afraid of not being reelected. So they
Yeah,
think they still have a coalition of Trumpers and who want, they go against everything, just like even the gun ban when they had the shootings and everything. They are so stolic about being a Republican and getting back in the office again that they're just scared to go on the sideline, even if it's common sense. So don't wear a mask means you're still for Trump and I can get elected again as a Republican. Party lines.
what do you think we'll ever do anything about the gun situation? Because the lobby, the gun lobby is powerful. You think we'll ever do
Well,
anything?
unless somebody has enough money to go against them and buy off those senators and representatives, and we have enough money to buy them off and say we offer you more money than the National Rifle Association, sure. But until somebody is really rich and can have a lobbyist to pay them more money than the National Rifle Association, no.
What
Money-
about the executive action by Biden?
Yeah, but that only lasts as long until, but like our vice president said, until there's a legislature and a law put in place, it's not going to last that long. But it's good for right now. But it's only tentative.
Yeah, it's pretty disgraceful though. It's amazing how a year ago it all began.
Yeah.
We didn't know it then, I guess, but beginning of a stressful year, as the Reverend Patty had said.
Didn't it begin in January when Trump was talking to the reporter about COVID? And didn't
Well,
tell
it
anybody?
actually began in December 2019, but in terms of us recognizing it, it was March that we recognized it. But right, there was evidence of disease as early as December of 2019, certainly by January. Yeah.
Well, he knew about it then.
Yeah.
He wasn't the only one.
Yeah.
They kept it quiet for a while.
Well, I don't think they kept it quiet. They mishandled it. It's not like they kept it quiet. They mishandled it. They knew what it was. They didn't know how to take care of it. And then our efforts were
Anemic.
We're anemic. Yeah, that's a good term. Yeah. We were too late to get on the bus. Too late. Looking back, boy, you talk about what it did to Broadway. Woo! Completely eliminated Broadway. Eliminated almost everything, though, when you think about it. For 1 year, full year. I think few cities have been hammered more than New York and city in Los Angeles.
Y'all hear about the new mayor in Boston, the woman, Black woman? First woman mayor and first Black mayor of Boston.
That's for Boston, that's shocking, yeah, right. It's amazing how this pandemic has caused people to be so much more sensitive to the Black and brown people's issues as never before. It was amazing to me how long it took for them to declare it a pandemic.
Yeah.
I was surprised.
Well, Trump said it'll go away automatically.
Yes, he did. Said when
Yeah.
it get
Magically,
warm, it's just
magically.
like the flu, and it's gonna go away.
Magically, it'll go away.
Yes,
Yeah, yeah.
Rub some Clorox on it.
right. Or as the summer sets in, it's gonna be gone.
Yeah.
That's what he said, yeah.
Yeah.
Well, what actually got gone was Trump, and that's a good thing.
Mhm.
Mm, mm, mm.
Yeah, interesting enough, you may be right. That may be the major reason why he lost the election. Without it, he may have been around for another 4 years.
I don't think we couldn't stand it.
No, we couldn't, but
My mom kept saying right before they start shutting everything down, and I couldn't understand because she loves church, and I'm calling. I said, okay, I'm coming to pick you up for church. She kept saying, no, I don't know what it is, but I don't think I'm going this Sunday. And I'm the next Sunday, she did the same thing. And I said, well, what's the matter? Is it that you don't feel good? She said, I don't know. It's not that I'm sick, but something is going on and I just want to stay in the house.
wow.
And right behind that, that last Sunday we were in church and our pastor said, that's it, y'all, we're shutting it down.
That's amazing how she had that vision
Yeah.
without knowing it.
She didn't know it. She didn't know what it was. She just kept saying something just wouldn't let her. She just kept saying she didn't know. She wasn't sick, but she just needed to stay in the house.
Mhm. That's the
Yeah.
discerning spirit of God.
Well, that's right. Now that's true.
That's what was going on with your
Amen.
mother.
That's right.
Amen. We ain't trying to have church right now, but
But that's the truth. Truth is
Well, you know,
Bonnie,
many,
go ahead and sing something for me, baby.
I always say, I listen to the seniors because they are wise and they know.
Oh, bless you.
Mm.
yeah, so many ministers have died too from.
Oh, yeah.
Yeah.
Yes, stubborn.
Yes. And the worst part was President Trump was calling it China virus, Kung flu virus, and that caused so many Asian Americans to get killed and beaten up and cut
Yes.
and everything. Oh
Yeah.
my God! Since 2 years, they're attacked.
This statement here is very upsetting when you think about it.
Well, it's from Fauci.
What is that?
It
They thought that 240,000
was an exaggeration.
going to be too much. It's more than twice that now.
Right.
Yeah, that shows how ignorant we are, really. Yeah, and that's why other countries look at us and laugh.
Yeah.
You think we're so smart and so powerful, and we've demonstrated that we are not.
Yeah.
Well, it's a freedom. We have too much freedom.
Well, and I think Darryl said it best when he mentioned the fact that the more autocratic countries can deal better with issues like this.
Yeah.
Wow.
I guess the most distressing thing of all is the school closing
Yeah.
and how negatively it's impacted our children
Yes.
and the suicide rate in children. It's frightening. Thank you for joining us, Francis. We're getting off pretty shortly too. It's almost 10:30. So, but the impact upon the schools has been devastating, especially among the people of color,
Yeah.
children of color.
Yes.
And I don't know how long it's going to impact our children. This 1 year that has resulted in us, our academic standing in terms of United States children was not that high before. But it's going to be even worse now.
Yeah.
What do your teachers think about it? We have so many of your teachers in the audience. What do you think about it?
The teachers are hating it. The teachers are hating it.
I think that every teacher should be guaranteed to get that vaccine first before they are required. You know, some school systems, like even PG, are requiring teachers to come back, even though you know they're being a little lenient with it. But if teachers are not 65, you know, a lot of them are not able to get the vaccine yet. So teachers unions are standing up for them, but darn, you know, these little snotty nosed kids, you know, bring the virus from home, bring it back to school, and then, you know, it's another explosion of the virus rate. So.
Yeah, I know there was a governor, I forget where, who I know was a CEO who kind of got fired because he resigned because he wanted to ensure that all of the teachers got the vaccine. And I think you're right. I think before the teachers come back, they need to all be vaccinated. I think.
Just like the medical field, not all the health providers are getting the shots or want the shots. So not all the teachers want this vaccination.
That's correct. That's correct.
And they don't want to go back because they're fearful. They don't want the vaccination. And a lot of my own personal grandchildren said, what's the use of going back? Because you're more in jail. At least at home, you could be lounging around. But they go to school, they got to stay in one classroom while the teachers are traveling. They got to sit at their desk all day long. And whether or not they go to lunch, some of the schools are requiring that they sit at their seat and eat their lunch also. And they still are learning on the computer. The teachers are still doing the virtual because half the school comes in 2 days, the other half comes in the other 2 days, and then 1 day is teacher preparation. So what's the difference between staying at home and going to a building and staying stuck at a desk all day long?
I guess we'll find out. I guess we'll find out because one thing is clear. The situation that exists for the last year is untenable. And so we need to find ways of getting things back to a situation where you have social interaction normal again. And I guess that requires everybody being vaccinated, or at least 70 to 80% being vaccinated and having herd immunity. Because as they look at the suicide rates among children and well, among people who are Hispanic and African American, as well as children, it's doubled, and so that's untenable. So we got to do something. Your points are well taken. We got to do something to change it around so that we got to get back to the social interactions the way it used to be.
But Dr. Callender, remember when we were discussing in group session before the coronavirus about the suicidal rate? And I think Janice, your grandchildren were alluding to why teenagers are depressed. What's going on in our society and the technology and the media and all of this is coming into play. And now they're on technology even more, which concludes that's why more teenagers are depressed and killing them. The cyberbullying and all of that comes into play.
Well, actually, the data shows that you're right. That was true before coronavirus, but since coronavirus, it has doubled. So what you're saying is very true. But since coronavirus, more Blacks and more Hispanics are killing themselves. More teenagers themselves. So then it's twice as bad as it was before coronavirus. So it was bad before, but it has gotten much worse since.
And also, Dr. Callender, the children, a lot of them had free meals, And it was a hard time for a lot of parents to put food on the table. Schools
Still is,
supplied
and
the free meals and snacks, and I saw it on first hand, and I was distributing food right around my house. There is a, elementary school. So those children wouldn't have, they would have, a lot of children were starving. Parents didn't have food to put on the table.
And every Sunday, when we go out, we see churches that like, I guess like Dr. Carey's church in Pennsylvania Baptist Church and other churches in Maryland. You see the car lines of people who don't have food. So
Yeah.
all of this, it's been an incredibly awful year. And so many people they've lost their jobs, they lost so much that I don't know when we'll recover from this pandemic year. It's going to take a while.
I have a question for the group. I think I discussed this with Dr. Callender yesterday, but a friend of mine, in fact, he was my best man at my wedding. His father was a Tuskegee Airman who passed away last week, and his funeral is the 1st of April, which is our next group session. But I was wondering what the group thinks about going into a church indoors for a funeral with 200 people in a service like that. I mean, I love this guy. I loved his father as well, but and I've had my both of my shots, over a month ago for the second shot. My wife just got her second shot Saturday. But what do you guys think about that? Do you think this is safe to go into a church for a funeral with 200 people?
How big is the church?
That's a good question.
Wear your mask.
Can you social distance in this church?
Right.
Essential water. They keep the water.
I don't know.
Are there other
Wear your
rooms where they
mask.
will
Fine.
have, where they can sit and still view?
Ventilation is very important. Our church, that's what we are actually talking about right now, because it's an old Jewish synagogue. And I'm here to tell you, it ain't ventilated very well.
See, we just had renovations. They're still doing renovations on Mount Pleasant, and our pastor said that they have upgraded the ventilation system. But I don't know when he's gonna open back up to full congregation. Right now, Palm Sunday will be 50, maybe 50 people.
Wow.
He's starting there because the concern is I can't be sure I can keep you safe. You may have had your shot, but the other person may not. Someone else could possibly be a carrier. You don't want to put yourself in that situation, and I don't want to be responsible. So, but going to some service like that, I don't think I could do it, and I'm sure people would understand if you can't and the reason why. And I'm sure they'll have it on Zoom where you can watch it. But if you must go, you should really find out how big the church is and if you can social distance.
There's another practical concern, which I mentioned to John, and that is, what is your wife's perspective on it?
Now that's the truth.
That's very true.
A happy wife is a happy life.
Happy life.
And also, Dr. Callender, I agree with you. My husband and I, we have decided since the pandemic has broken, we're not going to any church for anything. And plus, our funerals, when we die, is private, no more than 15 people or so. That's within our own family. So it's up to each individual what you want to do.
Well, in his case, it's up to his wife.
Yes.
Because,
She gets the final say.
Because she has just been recently got her second shot.
Right.
Mhm.
And John, that means you're not going. Well, we all know that.
Right.
That's
I
the
hear
voice
you.
of a virtuous wife.
Oh,
Indeed.
You know,
Happy wife,
I
happy life.
really appreciate that. Absolutely, absolutely.
But
I
the
know what
irony
that
of it
means.
that I'm noticing around this vicinity, churches are opening up for funerals rather than opening up for worship service. There are several churches around here that have a big business booming now because they have gotten their churches all together and they're letting different people from different congregants that churches are not opening up. And they're saying, have the funeral here. And they got their people out there and they're making big money by having their churches open up for funerals.
oh, Lord.
I played it. I'm sorry to say, I played it one. It was at a funeral home, but then I went to a wake at another person and they had their, the way you go in and out and everything. But the churches, to me, I don't understand why they're opening up for funerals and not for worship service.
Yeah.
Mhm.
Very interesting. No, you hit it right on the head. It's the money.
It's money.
Oh, Lord have mercy.
And they're charging big bucks to have the funeral there. They got
Oh,
all the instruments and everything. They'll clean the church up and everything
They
for you.
Did they Friday chicken, Carol?
Huh?
Did they Friday chicken?
So far, I don't know where these people are having their repast, but so far I haven't heard of the repast, but you know we gotta have the repast.
There's a chicken.
So, but I've heard of the funerals and some of us are musicians on here. I don't know. I'm not gonna call your names, but have any of y'all sung for a funeral? Am I the only one that's played for one?
Oh, yeah.
Honey, haven't you sung for a funeral?
Several.
So
There were only like 15 people there and we were social distance. And for some of the funerals, I sang with my mask on.
Oh, really?
Oh, yes, indeed.
Hmm.
Oh, yes, indeed. I had that mask on and it went very well.
Because she's got a voice that
Okay.
can carry through that mask. And it's beautiful.
Wow.
Thank you.
Wow.
Here's a CD
Well,
recommendation.
it's a guy at Metro, actually one of my friends, childhood friend. He's in a different department. He's in the Treasury Department. So he was just diagnosed with COVID on Tuesday, and Jimmy, and he was with one of his coworkers last week, and he kept telling his coworker, "Man, put on your mask, man. Put on your mask. You're walking around here and you're talking to people, and you don't have your mask on, man. You got to put on your mask." And also with talking to people without his mask on, he says that he walks around the hallway and he plays his harmonica and all this other stuff. So I'm just playing his harmonica. So when Saturday, he was doing some work on the deck. He came home Saturday evening and wasn't feeling too well around like 6 p.m., got into bed around 7, woke up around 10. His wife took his temperature. His temperature was only like 99.7, but he said he didn't feel good. So his wife scheduled an appointment for him. He went and got tested on Monday. Results came in on Tuesday. CDC told him to call everybody that you've been around for the past 5 days. He called everybody.
Contact.
And he called this one coworker that he had been around that's been walking around playing a harmonica. His name is Marcus. So Marcus was like, "Damn, man, you tested positive. Wow. Okay, so I guess I'll go get checked. Man, you know, I was out for the past 2 weeks. I just came back to work this week. I've been sick, man. I was sick like I don't know what." So my boy Jimmy was like, "What? You been sick?" He was like, "Did you get tested?" "Nah, I ain't even think about it. My wife, man, she real sick right now, man. She at home. She been home about 3-4 weeks. She can't go to work, can't do nothing." He was like, "Man, please go get tested." So I called my boy yesterday, and I was like, so look, man, how you feeling?" "Man, I'm good. I just had that one little fever on Saturday. Sunday was fine. Monday was cool. Tuesday was cool. I'm fine. I don't feel anything." So I was like, "Okay, cool." I was like, "What's up with that guy, Marcus?" "Man, you ain't gonna believe this." I was like, "I already know it." I already know it. He said him and his wife tested positive.
Wow.
Tested positive. So his wife is real sick, lost her sense of smell and taste.
Oh.
And
So they were sick, but they didn't go to the doctor.
real sick. It did not go to the doctor.
In the meantime, just spread it.
Big time. Big time.
Very
So,
sick. That's sick.
yeah,
I don't know if I
ridiculous.
understand from the CDC recommendations, they say that after you have vaccine immunity, you have your grandchildren, you can be in small private gatherings, no more than 25 people with everybody else who's had vaccine immunity. And so if that's the guidelines, that would say that you don't go to funerals, you don't go to nightclubs, you don't go to restaurants.
Right.
Right.
Mhm.
But here's the thing, though. Here's the thing. He said, my buddy Jimmy told me that he was just diagnosed on Tuesday, tested positive on Tuesday. CDC told him to stay home, don't go to work, don't go anywhere, don't go out of the house, quarantine yourself. You can leave out of your room and go to work on March the 31st.
Okay.
March the 31st, you can go back to work. Do not get tested for another 6 months. So I was like, what do you mean you can't get tested for another 6 months? He said the reason why they don't want you to get tested for another 6 months is because the antibodies will still be in your system, and it's a possibility that you still may test positive. I was like, hold on, man.
So why are you going to work?
Why are you going to work?
Right.
That doesn't make any sense to me.
No.
No,
Not contagious.
no.
Yeah.
So
Mm.
he said he's still going to go get tested because he
Sounds
said he doesn't
dangerous.
want to take the risk. He
Run
smart
to
guy,
get
very
tested.
smart. He said he doesn't want to take the risk. And with Metro, they will put you on administrative leave and they will continue to pay you until you test negative. And then when you test negative, that's when you're allowed to come back to work. But even when you do that, there's so much that we will have to go through to for them to allow us to come back to work.
Yeah.
So it's times where I want to call in slick and and stay home for a few days, but I'm afraid of what the repercussions may be when I would try to come back to work. So those 2 or 3 days that I would like to stay home, it may turn into 5 or 10 days, you know? So,
I got a question for you, Chris. What about all the people who are on the bus?
what the
all
bus
the-
operators?
All the bus operators and the riders on the bus.
That part, I'm not exactly sure, but when I'm around the stations and I'm outside the station and I see the bus operators and stuff, they have their shield, and then there's another plastic cover that covers from the shield that goes to the window sometimes. It's up to you to wear your mask and a mask on top of that and another shield on top of that if you so choose so. So I'm not exactly sure what their protocols may be when it comes to protecting themselves. I'm sure it's up to you.
Yeah, I'm talking
It's up
about
to
the
you.
riders, the riders that come on the bus and they pass by the driver on the way back to their seat.
They're definitely taking it. As an operator, you're definitely taking a chance with dealing with the public. I mean, you may know that you're negative, but Janice Stevenson that may want to ride the bus that day, she may be positive as I don't know what. She coming in there, she tapping her card all on the daggone fare box and yeah. I'm glad I'm on the train right now. Yeah, but even with me being on the train, we still come in contact with customers because sometimes we have to walk through the train to go to the opposite end if the train is still in motion.
Yeah.
Sometimes we may, when the train is out of service, we may have to get customers off the train, the ones that are still asleep on the train, because we get a lot of homeless passengers and a lot of inebriated passengers where they use that train or that bus, but I know specifically with the train now. They lay around, they find their little corner, they curl up in that corner and they go to sleep. So yelling at them to get up is not enough. So what I'm supposed to do is get on my radio and call transit police and all this other stuff to have them come down and wake them up and get them off the train. But that can take anywhere between a couple of seconds all the way up to 10 or 15 minutes. And I'm not waiting. So I have my gloves on and stuff. And what I'll do is I'll just take my knuckle and I'll put it in their chest to wake them up and help them out the door.
Sounds like to me you all need body shields.
Say again?
You need body shields.
on the yeah, we wish we could get something like that, but no, that's
body
not
condom.
possible. That's not possible. But also, I'm gonna let you all know this too. If you all ride the train enough, you know there's two different types of trains now. You have your older trains, which we call the legacies, and then you have the newer trains, which are those nice, pretty silver-looking trains and stuff. The older trains, the ventilation system comes through the operating cab where we operate at. So all of that air and funk and everything that's out there with you all in the passenger area, it comes directly through our door and gets sucked in the ventilation system that's directly over top of our head. So with the old trains, I'm still riding with my mask on and stuff in the old trains while I'm operating the train, because if you out there and you had a rough day and all that funk comes directly into my face. The newer trains, the ventilation system is out there with you all. And actually the ventilation system is way better than what the older systems are. And which we are very thankful for. It helps, not only helps us out, it helps you all out as well. So it doesn't matter how many times they change those daggone HEPA filters in the older trains. We still breathing in all of that daggone funk.
So,
And
Chris, is there any kind of report from Metro as far as infections?
when it comes to operators and
Yes.
the employees and stuff, they don't give us any of that information. It's just a lot of hearsay and word of mouth and stuff like that. That's it. A lot of times, this is how we find out. If I don't get the word from one of my coworkers that CJ, he works at the Glenmont. I'm at Glenmont right now. CJ, he works at Glenmont, and CJ tested positive for COVID. I don't know that, right? What will happen is when CJ calls in the clerk and say, hey, I'm gonna have to go out for a while. I tested positive. I'm gonna fax you all my information, what the doctor said, and this and that. What will happen at that point is the clerk will contact the superintendent would then contact CDC and all that other good stuff. They will send the hazmat team in either that day, that evening, or the very next day to come in and disinfect the whole building. Then once they disinfect the whole administrative building where we are at Glenmont, they will go to the station